Hello there, my name is Brooklyn Dillon and I'm from Bluefield State College. I'm here to talk to you about the communicable disease known as the West Nile virus. The West Nile virus affects the global community and is becoming an increasing issue in the United States. This virus is distributing over a wide area and infecting more and more people every year. In 1999, this virus first made its presence known in New York City and has now become established in 48 states of the United States. The West Nile virus became an epidemic in the U.S. by the year 2002. This infection is severe due to the fact that 35% of people with the infection develop meningitis. Due to this, the CDC, Centers for Disease Control and Prevention, continually provides surveillance of this virus. However, the West Nile virus is not listed on being mandatory to report. The reportable disease associated with this virus is known as the West Nile fever. This occurs in approximately 20% of cases. This is more with the severe side of West Nile virus. I'll talk about it later, but this is more of the meningitis and neurovascular side of it. The West Nile virus is a vector-borne virus and a single strand of RNA of the Flaviviridae family. The West Nile virus is commonly spread to humans by the bites of infected mosquitoes. The hosts are often mammals such as horses, humans, squirrels, and other hosts such as birds, turkeys, or chickens. The West Nile virus has a continuous cycle between mosquitoes and birds. For example, when a bird host is infected by the bite of a mosquito carrying the West Nile virus, the virus will then amplify in the bird. Then, if an infected mosquito was to bite an infected bird, that mosquito would then have the West Nile virus as well. This would allow both mosquitoes to spread the infection to humans and or other hosts. Bird hosts are the key to this cycle due to their capability of amplifying the virus. The ability to transfer the virus to other mosquitoes that will in return infect more birds. On the other hand, humans and other mammals are considered the dead-end hosts. This means they do not develop high enough levels of the West Nile virus in their bloodstream to pass it on to other mosquitoes that bite them. So the birds and mosquitoes is a continuous cycle. It's going to keep spreading and acquiring on more birds and mosquitoes. However, if the mosquito that's infected would bite a human, it would stop there. The human could not spread it to other humans by kissing, touching, anything like that. Other routes of the West Nile virus transmission to humans have been determined but are rare. This includes cases such as mother-to-baby transmission during pregnancy or breastfeeding, blood transfusions, exposure in laboratory setting, and/or organ transplantation. It is important to remember that this is very rare, and West Nile virus is not transmitted, such as kissing, touching your animal to human during casual contact. The West Nile virus cannot be spread to the human by handling dead birds or living birds that are infected. However, we should always wear gloves when touching a dead bird because they can have other sorts of diseases that you could get. As well, eating infected birds and other animals will not transfer the virus to you. This was found on the Centers of Disease Control and Prevention's website. An unusual fact that I found that was interesting to me was that almost half of these cases of the West Nile virus, especially the more intense kind, such as the meningitis and etc., has been found in Texas. In Texas, actually, they have people going around spraying insecticide on the sidewalks and stuff in the summer. And the spray actually has been killing people as well. There was 10 deaths I found that was noted in 2012, and they've been doing it every year still. Most cases of the West Nile virus happen from July to September, but rarely in winter months. The West Nile virus is intensified during warmer climates due to rain and humidity. This means global warming may cause an increase in the West Nile virus cases. The West Nile virus is a focal disease and tends to depend on local conditions. Warmer weather conditions are linked to the spread of West Nile virus due to extending length of mosquito season. Higher temperatures also will allow mosquitoes to reach a high by the biting age being sooner, and which will allow for more infected mosquitoes to bite humans and birds, animals. A rainfall is ideal for mosquitoes due to standing water that will accumulate. This will This is great for them to breed in, large breeding areas, as well. Areas which there's a lot of foreclosures, pools, ponds. If a pool hasn't been maintained, standing pool water, that's a great area for mosquitoes to breed and have an increase in the West Nile virus, because there'll be more ways of transmission. As well, southern states have a higher incidence. Like I said, with the foreclosures, also standing gutters that haven't been cleaned out in a really long time, places where they don't take care of their lawn, bird baths, gutters, etc. Anyone who lives in an area where West Nile virus is present in mosquitoes is at risk for developing the West Nile virus. The only 2 states in the U.S. that have not reported an outbreak in the West Nile virus are Hawaii and Alaska, which are not attached directly to the U.S. Since 1999, outbreaks have occurred every year. People at greatest risk for severe disease related to the West Nile virus, such as West Nile fever, are persons over age 60 or persons diagnosed with diabetes, hypertension, cancer, and kidney disease. Also, people who have had an organ transplantation are at a greater risk of morbidity and mortality. West Nile virus causes serious neuroinvasive manifestations such as meningitis, encephalitis, but this usually occurs in about 1% of people who are infected. This can cause long-term neurological effects and can be lethal. Approximately 10% of the neuroinvasive disease cases will end in death. The incubation period for the West Nile virus is often 2 to 6 days, but it can take up to 14 days for those with a weakened immune system, as I stated above, with diabetes, the organ transplant, stuff like that. Of the few people who develop the febrile illness, West Nile fever will develop flu-type symptoms such as body aches, headache, vomiting, diarrhea, joint pains, or even a rash. The clue that these symptoms are not the flu, though, and is in fact the West Nile virus, is whenever you have these symptoms and it's not flu season. Usually, with the West Nile virus, it's going to be in the summer months, which usually you don't have the flu. Most with West Nile fever will completely recover. Nonetheless, weakness and fatigue may last for weeks and/or months. People who develop a severe neurological illness such as meningitis or encephalitis, which is inflammation around the brain and surrounding tissues, will have serious and severe symptoms. These can include stiff neck, high fever, headache, disorientation, tremors, paralysis, seizures, or even a coma. Recovery for this severe disease may take months, and the neurological effects may be permanent or fatal. Diagnosis for the West Nile virus is done with the combination of medical signs and symptoms, along with certain laboratory tests such as taking spinal fluid or blood. These tests detect antibodies in the immune system that will develop against the viral infection. Unfortunately, there is no vaccines or medications for the West Nile virus available to treat and/or prevent the West Nile virus at this time. Fortunately, many scientists are working towards developing a vaccine, and we are hopeful that the vaccine will be available in the near future, which would be great. Over-the-counter fever and pain reducer are helpful for the symptoms associated with West Nile virus. People usually recover independently when mild symptoms are present, and it usually lasts a few weeks. However, when severe symptoms are present, one may need to be hospitalized to have nursing care such as IV fluids, breathing support, pain medicine, and etc. The community health nurse is responsible for disease prevention and education. The nurse should always include tips to avoid mosquitoes. Tips would include limiting one's time outside between dusk and dawn, wearing light-collared clothing, wearing long sleeves and pants, placing mosquito nets over baby strollers and when outside, having proper screen doors and windows, avoiding standing water, drilling holes in flower pots so that the water won't stand in the flower pots. Make sure rain gutters are drained properly. Make sure pools are cleaned and dealt with properly. Wear insect protectant with DEET, and keep swimming pools and hot tubs properly chlorinated. Nurses are to ensure people are aware that they are required to report dead birds and standing water to the authorities. These may be a sign that the West Nile virus is mingled between mosquitoes and birds in a certain area. Reporting this allows humans to provide a role in monitoring the West Nile virus. People should determine their state's health department's policy for testing and collecting birds in your area, because each agency will have different views and regulations. Nurses are well positioned to educate their patients about local community control and surveillance programs such as mosquito control programs. This often includes methods of how to eliminate mosquito larvae environments and how to use insecticides to kill mosquitoes and/or larvae, and support system phone numbers, etc. Health nurses can set up a community screening as a source of information on arthropod-borne infection. Since jobs that require one to be outdoors, being homeless, over 60, and having limited resources can increase one's risk of getting the West Nile virus, the nurse can advocate for these patients in the community. The nurse can do this by bringing the public's attention to these issues and health hazards. Raising info on this issue could bring the community together and even start a whole new fund that would provide persons with resources such as screens for windows if one couldn't afford it, insect repellent to be available for free for those that have jobs outside and have these risks, people that can afford it, stuff like that, bug shields, and etc. The nurse could also set up a support group for those affected by the disease or has lost someone to the West Nile virus or has had a neurological illness that is now permanent. In conclusion, the West Nile virus affects the global community in numerous ways. In order to defeat this virus, the global community must work together by staying educated and informed on the evolving West Nile virus, as well as being informed of any new vaccines, medications, or any new information. Another interesting fact, which I was really kind of surprised about, is one of the only states this year that has not had a human-borne West Nile virus infection would be West Virginia. There was only a few, and we were one of them. And I actually found that kind of shocking, but it said that we didn't have as much rain this summer as before. And hopefully people are becoming more educated and are protecting themselves against mosquitoes in our area. Thank you for listening. Have a nice day.